Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week, and thank you to all my friends at Tandem Radio and the Bridge FM for allowing me the opportunity to speak to you each Saturday. It's been a real blessing and just a treasure each week to see where the Lord leads me into directing me into the subject matter that I've been providing you now, over 56 weeks now. And it's been really a remarkable experience. I've been a public speaker for 20 years through a company I have called Wellness at Work. And I speak throughout New Jersey, primarily lunch and learns and keynote addresses at companies and organizations. And radio is such a different discipline because there is no one to stare at, no people. So it's been a learning experience for me. But the feedback has been great. And what's really nice about it is the feedback, not necessarily, or do I care on how good I'm doing. I'm more concerned about the subject matter is making change in your life for the positive, and for, more importantly, that we follow God's plan for our nutritional, physical, and psychological needs, and not man's design. So the show over the last bunch of weeks has really provided me some great feedback from you guys. As you know, each week we talk Luke 1:37, for with God nothing is impossible. And that's how I feel so many times in my office. I'm in my office a lot of hours every week, going knee to knee with patients, and seeing the physical changes, seeing them make nutritional changes in their life and start thinking clearly, not having that brain fog in the afternoon, not having difficult sleeping anymore, being able to, maximize the way they feel and the way they're functioning throughout their day. It is a great blessing. It's an amazing career, meaning that I truly enjoy and love what I do. And so I just wanted to thank Tandem, the Bridge, and you guys for listening. We started last week a topical show. Topical meaning it's not one of the foundational shows. You could go to the YouTube channel or through tandemradio.com and look through all of the shows we've done over the last year. But we started osteoporosis last time, and I shared with you that osteoporosis is a downstream disorder many times from a systemic breakdown. So in other words, our bodies, which are made up of multiple systems over a period of time, will break down, become dysfunctional, become damaged, and the body robs nutrients and essential minerals out of the bone to put it somewhere else. So the brain decides what is priority. So for instance, your heart is a muscle that needs calcium in order to beat. So if your body determines that there's not enough calcium in the blood to get to the heart, it's going to say, hey, the heart beating is more of a priority than keeping it stored in the bone. So that's why I shared that your bone is like a bank. You're either putting stuff into it or taking it out. And you want to be putting more stuff into the bank than you take out. So the brain would then decide, hey, we need to send calcium to the heart, so we're going to rob it out of the bone and put it into the bloodstream and send it off to target organs that need that essential mineral. And that's just one example of how osteoporosis is a downstream effect of more of a systemic problem. 75% of women in our country don't even get the RDA of calcium. And teenage girls are even worse because they're consuming, or many women are, but teenage girls are consuming so much soda. And I shared with you many weeks ago, I did a show on soda. Soda contains phosphates, particularly cola. Cola contains phosphates, which actually tears even more calcium out of the bone. So remember, our bones are made up of our storehouses for essential minerals like calcium, phosphorus, and magnesium. Okay, osteoporosis is not just simply a loss of calcium from a bone. It is the fact that our body, intelligent design by God, it's a response to long-term imbalance, and it's a breakdown of bone and its essential nutrients back into the bloodstream that causes the bones to become osteoporotic or osteopenic. And that means weakening and shallowing of the bone mass. It's loss of bone mass. So when we look at bone building and bone robbing factors, again, this is constantly happening in your bones. You're putting bone building stuff into the bone, like putting money in the bank, or bone robbing. And you want to keep a positive bone building scenario in your life so that we do not have bone loss. Now, bone density is something that shows bone loss. So for instance, I take many x-rays in my office, and many times on x-ray, I could see bone loss. An x-ray is not the preferred method to measure bone density. Bone density should be measured by a bone measuring instrument, which is a bone scan. Okay, so bone scans, a lot of you gals out there have probably had a bone scan. That's the way that we measure bone density. So let's just talk quickly about osteoporosis. 1.5 million osteoporotic fractures each year in the United States. About a little over 500,000 of them are spinal fractures, and about 300,000 are hip fractures. By the age of 65, 1 out of every 3 Caucasian American women will experience at least one spinal vertebral fracture. Now let's talk about that. By age 65, 33% of Caucasian American women will experience at least one spinal vertebral fracture. Now that doesn't mean that you had a spinal fracture because of trauma, like you had a car accident or you were playing a football game at that age. It means that the bone weakens to a degree that literally a cough or a sneeze, or you roll over in bed, or you bend forward too abruptly, the bone is so weak in the lower back or in the mid back that the vertebral body breaks. It's called a compression fracture. And the United States has one of the highest osteoporosis rates in the world, yet we consume more cow's milk than anyone. Hopefully, you're going to start drawing a conclusion that cow's milk does not prevent osteoporosis, okay? There's plenty of other ways we could be getting essential nutrients, including calcium, in our food supply, particularly dark green leafy vegetables, and not using a product like cow's milk. You know, I tell my patients all the time, cow's milk was invented for a reason. God designed it to feed baby cows. Was it created to feed baby human beings? That's for another day. But I could tell you that the calcium and the protein content in cow's milk isn't necessarily great for our bones. So when we look at the epidemic of osteoporosis and the fact that 1 out of 3 women are going to have a vertebral fractures result in a deformation of the spine, many times with painful crippling. And once that vertebral body fractures, once you suffer a compression fracture, there isn't much you could do for it other than topical pain relief therapy, like physical therapy, maybe some injections by your pain management doctor. So, you know, when you look at surgical techniques, many times for these types of situations, there are orthopedic surgical techniques available, but we want to avoid this stuff if we can. Spinal fractures can also result with chronic back pain, difficulty breathing, digestive dysfunction, increased mortality, loss in height. So the fractures of this vertebral column, which are common, 1 out of 3, right, over the age of 65, is serious. But most people listening, you've probably known someone who has suffered a hip fracture. Now, hip fractures pose the greatest threat with respect to osteoporosis because a hip fracture, up to 50% affected, need permanent help with daily living. 20 to 30% enter long-term care, and 20%, sadly, 20% of people who have hip fractures due to a fracture die shortly after the hip fracture. So, you know, again, this is a downstream thing with osteoporosis. Normally, there's other processes, there's other systems in the body that have broken down. There's other disease processes going on. And we want to identify osteoporosis or osteopenia as early as possible. So I talked about a bone measuring test called a DEXA scan, DEXA. That's a bone density test. And for you gals out there, particularly in your 40s and early 50s, talk to your OBGYNs about getting a bone scan and also how frequently you should be getting one, especially if there is family history of bone loss. And you're diagnosed with bone loss at an early age. You want to stay on measuring. There is urine tests to also measure bone breakdown, and you want to do an assessment of risk factors. An assessment of risk factors is a form you fill out which can tell you where you are on the spectrum of risk, and that has a lot to do with what part of the world you genetically come from. Various parts of the world genetically have a higher incident rate of osteoporosis than others. And when you get your bone density test back, you're going to have something called a T-score. And the T-score will tell you in your lumbar spine, which is your lower back, and also your hip, whether or not you have osteopenia, osteoporosis, or if you have severe osteoporosis, depending upon your T-score. So the bone, or the word osteoporosis, as I've defined for you, and what tests are available to determine if you have bone loss, we just went through. Now, let's talk just briefly about what diseases, now this is not the lifestyle stuff, this is what diseases cause osteoporosis as a secondary effect, meaning that if you had an endocrine disease like hyperthyroidism or type 2 diabetes, or even pregnancy, okay, connective tissue disorders, bone marrow disorders, immobilization, meaning that you're not getting enough physical exercise, renal disease, which is kidney disease. These are actual diseases that can cause osteoporosis as a secondary effect. Okay, so that's really important to know. Other causes are like nutritional, gastrointestinal malabsorption problems like Crohn's disease or irritable bowel syndrome. All right, so we want to look at also types of liver disease that can cause osteoporosis or bone loss, and drug-induced bone loss from corticosteroids is also something that is somewhat common, particularly if you have an autoimmune disease like rheumatoid arthritis or lupus or ankylosing spondylitis. Many times the doctors will give a corticosteroid for inflammation because the patient is in pain, or methotrexate or heparin. These are drugs that can induce actual bone loss. Now, there's obviously a give and take there, because if you have to treat the upstream disease, knowing that you could be causing a downstream disorder like osteoporosis, you have to kind of give and take that, and that's something you should talk about with your medical provider. Once we have the diseases ruled in, ruled out, then you and I my conversation is going to be about lifestyle. Lifestyle, these are non-disease risk factors. What are the things that you and I do every day? Let's say we don't have renal disease, we don't have Crohn's disease, we're not taking corticosteroids, right? We don't have hyperparathyroidism or hyperthyroidism, we don't have a bone marrow disorder. What are the things every day that can be contributing to bone-robbing factors? Well, if we have a diet that's deficient in vital nutrients, that's pretty simple. And since we've industrialized our farming over the last 150 years, make certain that our soil does not have the same nutrient content that it once had when we were all farmers and sort of lived in an agricultural environment. So also diets containing large amounts of bone depleting dietary excesses. This is processed food, byproducts of wheat, dairy products even. By creating an inflammatory process in the gut, we are actually eating a diet. Many times in America, 90% of the food budget is spent on processed inflammatory food that contributes to a downstream effect like osteoporosis. Next one, lack of exercise, chronic inactivity. We know there's a lot of that going on. Poor or weak digestion, menopause or other estrogen-reducing conditions, tobacco and alcohol excess, stress, and long-term medication use. So this is a simple checkoff list. If we look at our diet, lack of exercise, poor or weak digestion, maybe some of you gals going through menopause, if we're consuming tobacco and alcohol, please stop. Stress or untempered stress needs to be dealt with, because stress is going to increase that cortisol, right? It's going to increase stress hormones, which are going to have a bone-robbing scenario to them, and long-term medication use. So when we look at our lifestyle, we then have to conclude if we don't have a disease, we have a higher lifestyle risk of creating bone loss through the things that I just went through. Okay, bone density, okay, is incredibly important when you look at the DEXA scan results, but also you have to look at the risk factor assessment. And those risk factor assessment means looking at your lifestyle. All right, so when we look at what we're doing day to day to prevent osteoporosis, one of the things that I gotta go over with you is being on your feet less than 4 hours a day. Many of us sleep 8-9 hours a day. We sit in a chair 8-9 hours a day at work. We sit in a car, we come home, we sit on a couch. If you're on your feet less than 4 hours a day, you are increasing your risk of getting this bone loss. We need to go back to God's design and focus on a plan of being like farmers. Being on our feet is a healthy thing to do as opposed to sitting and lying down throughout our day. For those of you with desk jobs, get up and move around. We need to get on our feet and we need to start moving around. All right, so this is incredibly important because these bone depleting factors add up over time and they all contribute to bone loss. We're going to continue our conversation next week. Please, I'm going to conclude the show. Go to drproodian.com, which is my blog site. I blog every Wednesday. I've done for the last year or so. And that website is free. It's full of chock full of information on everything that I speak on the show. And I really am asking my audiences to become blog members. And thank you for listening to me, Dr. James Proodian, and the By Design radio show this week. Proodianhealthcare.com is where you could find me, where you could submit any questions for the show. Have a blessed week, and let's make some positive changes. Take care.